At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Unfortunately, more than 32 million Americans are living with osteoarthritis per the CDC, one of the most common causes of poor joint health in the U.S. Others include gout and tendon and ligament injuries. Poor joint health can lead to a variety of complications, including reduced mobility, chronic pain syndromes, and joint deformities. Over time, joint limitations and pain associated with them can significantly impact one's emotional well-being, leading to mental health disorders. So to learn more about the importance of maintaining good joint health, we're joined by Gerardo Jerry Salinas, a doctor of physical therapy with the STHS McAllen Outpatient Rehabilitation Center. Jerry, thank you so much for joining us.
Thank you for having me. Always a pleasure.
Now, first of all, let's talk about what is a doctor of physical therapy. We hear that a lot, and we want people to know that you have extensive education, right?
Yes, so we're doctors of physical therapy. What I like to describe ourselves with is movement specialists, right? Biomechanics. When we are assessing patients, we're looking at how everything is moving from the joints to the muscles to their posture, etc., right? So we're looking at all the things movement related, and then trying to figure out what we're going to do to address the patient or treat the patients, right? Yeah.
Now, when it comes to STHS McAllen, you all are extremely busy there at the facility. I've been there many times, and I've seen you all working one-on-one with patients. What is the most common issue that you see with patients? Is it injuries like joint injuries like knee, hip, shoulder?
Yeah, so we get a little bit of everything. Like you said, we're super busy, which is a great thing, right? We're blessed. I would probably say the number one issue that we see is low back pain. The second biggest one or most common one is knee pain. There is a joint component to it, right? Sometimes it's a muscle strain, but then it can lead to a joint impairment or vice versa, right? So it's important for us to assess the patients and then kind of try to figure out what the issue is.
And when it comes to the joints that we're talking about, obviously you hear about knee issues. I twisted an ankle really bad once and had to do rehab for, I think it was like 3 months of rehab because I kept playing on it when I should have stopped.
Yeah.
And so I know when it comes to the rehab that you all do, how long does it normally take for a patient to kind of get through?
Okay, so it depends. That's kind of a loaded question right there, but it depends, of course, the level of activity prior to the injury and comorbidities, right, of a patient. So it depends. There's a lot of factors to it, so it's hard for me to give you a straight answer, but typically, I guess the average stay of a patient where it's like a joint-related injury, I would probably say about 2 to 3 months.
And do you see, when it comes to the patients that come into the center, are you seeing all ages? Are you seeing, obviously, as we get older, that wear and tear that we start to experience? So do you have a lot of seniors coming in, or do you really get a big diverse group?
Yeah, so at first it was more the geriatric population, and I feel like now it's kind of expanded. I mean, you've been there, you've seen our team, it's grown exponentially, and we have PTs that specialize in certain areas, and with that comes opening up doors to different clientele, right? And so right now we're seeing athletes, we're seeing geriatric patients, so patients from all ages. Of course, they all have their respective injuries or things that we're treating them for. But I mean, joint issues can happen to pretty much anyone.
And as a doctor of physical therapy, you are a movement expert, so to speak. Why is it so important to protect our joints?
It's very important because as we age, things change, right? There's more crackling, more popping. So as we age, we have to do more. We have to be more proactive. And I hope this presentation that I give today kind of gives a little insight to people that might be watching and take some of the stuff that I talk about here and apply it, whether they already have an injury or maybe they're just prehabbing it, right? Trying to avoid those joint-related injuries.
And you did create a great presentation for us, so let's get started.
Yeah, sure. So my presentation, of course, is on joint health. So I added this slide, joint health, move better, feel better, how exercise and supplements support lifelong mobility. I like this headline, right, because it says move better, feel better. I always say that motion is lotion, and joints were meant to be mobile, right? So we have to move those joints to stimulate healing, to stimulate the fluid that we have in the joints, and just keep everything gliding correctly. All right, so it's important to understand the different types of joints because we do have 3 different types of joints. We have fibrous joints, cartilaginous joints, and synovial joints. For the purpose of this presentation, we're going to talk about synovial joints. Why? Because those are the more freely movable joints. We're talking about knee joint, the hip, the ankle, elbow, wrist. Those are the ones that move more freely. The other joints, like fibrous joints, are immovable. An example of that is like the sutures in our skull, right? What keeps our skull together. Another example is cartilaginous joints. So we kind of tend to see more of that in the spine, pubic symphysis, which is a little cartilage that attaches both hips together and forms our pelvis. So those joints are not designed to move as freely as the synovial joints, but we'll get more into detail on what synovial joints actually entail. Why joints matter. So each joint type plays a unique role in mobility and stability. So like I mentioned right now, fibrous, cartilaginous, and synovial joints, synovial being the most mobile and the other ones being more for stability, right? So some joints are designed more to be stable, and then others like the hip and the shoulder, they're designed to move freely in all planes of motion. So understanding synovial joints allows us to exercise safely and effectively. Conditions like you mentioned, arthritis or joint injuries, often affect synovial joints, the ones we use most, right? So I like to explain it as almost like osteoarthritis, right? We mentioned osteoarthritis. Osteoarthritis is basically wear and tear. So if you think of like the tires on your vehicle, if we put a lot of mileage in our vehicle, the tires are going to wear down, right? And eventually we have to change the tires. Unfortunately for us, we can't, or I mean, we can change our joints, like if we have a total knee replacement or a total hip replacement. But those are the joints that get most wear and tear. So protecting and maintaining joint health means fewer injuries, better mobility, and more active lifestyle as we age. So we need to understand how we can keep those joints healthy, but at the same time be able to move and exercise and put the load on them. So articular cartilage. The articular cartilage, it covers the ends of the bones where they meet at the joint, so which makes the synovial joint capsule, right? It's made mostly of collagen and water. Very important, articular cartilage has no blood vessels and nerves. Articular cartilage is a highly stressed material. Compressive forces at joint surfaces can exceed 10 times the body weight. So it's also strong. While contact areas are generally only several square centimeters. So it's a very, very small joint surface area, but they can withstand a lot of compression. So due to its lack of blood supply, the articular cartilage cannot repair itself and requires stimulation, which is weight-bearing to repair itself. So there is no white blood cells, there is no blood being delivered into the articular cartilage. So the way the body repairs itself, we have to put strain on the joints to produce those repairing properties, right? So in the absence of physical activity, the cartilage may weaken and become less effective. So we see this a lot with patients that end up getting hospitalized and they're bedbound for like 2 weeks, 3 weeks, whatever the case may be. I mean, we see it a lot in astronauts too. There's no gravity, and they aren't getting the loads that are required in the joints. So when they come back into the atmosphere, they have a lot of issues with their joints, issues with bone density. The reason why is because the joints were designed, especially the synovial joints, they were designed to move and to undergo those forces, right? So let's talk about the hidden benefits of movement, right? I kind of mentioned a little bit right now, but the movement stimulates synovial fluid production, which lubricates the joint. So anytime we stand up, we're moving, it's sending input into our brain that tells us, hey, we're moving, we're loading, we're squatting, we're going up and down the stairs. These joints need more lubrication. So then the body goes through its physiological changes and it delivers that lubrication into the joints. Promotes autophagy, right? So autophagy is basically the clearing out of cellular waste, right? So we have tiny little receptors in the joints, and those signal when there has to be a cleaning out of the material that's not useful to our joints, and that's how the repair process goes, right? Reduces inflammation via anti-inflammatory cytokines. So cytokines are proteins that also signal, right? And sometimes they can be bad and sometimes they can be good, because if there's no injury and there's cytokines present, it's going to trick the body into thinking there's some type of inflammation, and then you can end up having like an autonomic immune response, right? We see it a lot with like rheumatoid arthritis, where our own immune system starts attacking its own cells. So cytokines, sometimes they can be good, sometimes they can be bad, right? Stimulates cartilage maintenance, right? So of course, like I mentioned, it's Wolff's Law. Wolff's Law says that we don't use it, we lose it. So we gotta stimulate those joint surfaces. So strength and flexibility. So the joints are supported by ligaments and also muscles, right? So strong muscles act like shock absorbers to the joints. So a lot of time with the patients that we see at the clinic, and they're having a lot of joint issues in their knees, for example, and then we test out their strength, and we find out that they have very weak hip muscles, very weak hamstrings, very weak quadriceps, and it's kind of like a snowball effect, right? And if we have an issue with one, for example, if we have an issue with the knee joint itself, we're probably going to have issues with the strength aspect of it, and vice versa, right? So if we have issues with the muscle itself, then we're probably not going to want to move that joint, which is going to lead to the joint getting deteriorated. So it goes both ways. Low impact activities enhance flexibility and are joint friendly, right? So sometimes when we do have these patients in the clinic that they already have a diagnosis of osteoarthritis, they have the aches and pains, we want to opt for more low impact activities. Examples of low impact activities are like cycling, swimming, things that are not loading the joints entirely, but they're triggering those responses that I just mentioned right now. So again, exercise improves balance, coordination, and posture, reducing injury for risk. So we have to have all those factors taken care of to ensure there's joint health, and when we're addressing the joint itself, right? There's a lot of moving parts. So smart exercise examples. So warming up properly, dynamic stretching, static stretching, light aerobic activity. So dynamic stretching would be more like the marching knees to chest. We're kind of moving, but at the same time we're stretching the muscle. Static stretching is when we just put our leg out and we're just kind of reaching and we just hold it. Each of them have their own benefits. I think research actually shows that dynamic stretching is more beneficial than static stretching. Again, I mentioned swimming and cycling. low impact aerobic activity. So patients that have a lot of cartilage issues already, and they go to the doctor, they get x-rays, and they're told they have osteoarthritis, and it's like there's different grades, right? Let's say they get told that they have moderate to severe arthritis in their knees, for example. A lot of the patients that we see when they come to therapy, they think that's the end, right? That's how they are, and nothing is going to improve it. And that's not always the case, right? While they do have articular cartilage changes already, there's stuff that they can do to improve their condition, right? Or maybe even prolong it from getting worse. Those like swimming and cycling, low aerobic activities are going to help maintain that joint and keep it from getting worse. Resistance training, so it benefits bone density, joint support, and posture. So the knees and the hips and even the ankles, they're weight-bearing joints, right? They crave compression, they crave the weight on them. But with that being said, we have to have that normal ranges of motions at each joint, so that it doesn't overwear a certain part of the joint itself. What I mean by that, I like to explain it to my patients because they have sometimes a tough time understanding that concept. I like to explain it as like imagine you're riding a car, right? And the tires are not aligned. So then the tires are moving in a certain way, and then sometimes the tread of the tire wears down a little bit more on the inside, or maybe the wheels in the front wear down a little bit faster than the wheels in the back, and then you have to change the wheels and do all that stuff. So I kind of explain it in that aspect, and then they tend to understand. And I'm like, okay, basically with what we're going to do with the rehab, we're going to help you move better so that the tread wears evenly and not just in the medial aspect of the knee, and then you have like medial meniscus issues, etc. I like to explain it that way. We're going to help you move better so the weight is dispersed evenly throughout the joint, and we don't wear the medial meniscus more than the lateral meniscus. And then they kind of understand a little bit better. So that's what I mean by loading the joints. We have to assess the patient and see, okay, they're getting a lot of irritation at this part of the joint. We want to improve their biomechanics so that the compression is spread out evenly. And that's how we can help, right? Tai Chi and yoga, it's also very low impact, enhances flexibility and balance, and it's very low stress on the joint. So that's something else that can help people that want to be active, but they have these diagnoses of osteoarthritis. Basically, these are just different options. I want to educate the public and just basically give them that awareness that there are options, and just because you were diagnosed with arthritis doesn't mean that is it, right? So supplementation, what does the science say? So I've had a lot of patients that ask me, like, does this work? Does the BioFlex work? All these different types of supplements that they sell out there. These are the ones that have some research. Some of them might have mixed research, meaning that some research says that it works and other research says that it's inconclusive. But omega-3 fatty acids, they have anti-inflammatory effects, and they're useful for joint pain, right? So that's a supplement that we can use. Vitamin D and calcium. We know that calcium supports bone health as well as vitamin D, and it can also help with joint function. Glucosamine and chondroitin. So that's a supplement that there is kind of a lot of research that says that it does work. Some research says that it doesn't, and some research says that it does, but it has to be at a very high dose. It may slow cartilage breakdown, but like I mentioned, the efficacy is kind of mixed there. Collagen may reduce joint pain and support cartilage, and I put these supplements because these supplements are very easy to find at like your local supplement store. H-E-B has a supplement section, or you can pretty much find them anywhere. So myth busting. One of the biggest myths: exercise wears out your joints. The reality: appropriate exercise strengthens joints and supports longevity. So like I mentioned right now, when patients get diagnosed with osteoarthritis, sometimes they get scared. They're like, I'm not going to walk anymore. I'm not going to squat. I'm not going to go up and down stairs anymore because it's just going to make it worse, right? And it's, for the most part, it's a myth, because the reality is if we improve your biomechanics, we improve your joint mobility, you should be able to tolerate at least some type of exercise to keep working on promoting that joint health, right? Another myth, high impact is the only way. So reality, low to moderate impact is safer and effective for joint longevity, meaning like what I mentioned right now, the swimming, the cycling, Tai Chi. So the key takeaways of this presentation: movement is essential for joint lubrication, nutrient supply, and flexibility. Strong muscles are foundational for joint protection. Supplements can support but not replace. That's the big one, because then some people might think like, oh, I'll just supplement it and I'll be fine. So it does not replace exercise and nutrition. So a holistic, balanced approach delivers the best results. So trying to hit all the factors, the stretching, the strengthening your muscles, the supplementation, and all that good stuff is what's going to deliver the best results ultimately. And this is our location of our outpatient clinic, STHS McAllen Outpatient Rehab Center. It's located at 1800 South 5th Street, Suite B in McAllen, Texas, zip code 78503. That's where we're located. We have an amazing staff. We're located right across McAllen Medical. And that's about it.
All right, that is all very good information, and it's interesting to learn about dynamic versus static stretching, because normally you just hear about stretching, just stretch, but knowing which type of stretches to do for what you're trying to achieve is really important. So let's go through a little bit of some of the common causes of poor joint health. So obviously injuries are one of the big ones. So sprains, strains, and dislocations can damage joint structure and like cartilage, ligaments, and tendons, leading to pain and instability. So dealing with those injuries, even if it's a small injury, it's really important to address it right away, right?
It's very important to address it right away, yes. And I will say, because we have had cases that they don't get addressed right away, and then they start building compensations, and then it's just like a domino effect from there. One thing leads to another, and now they're having, let's say they came in for their knee, right? But because they have that issue at their knee, they're not bending it. So now their hip or their ankle is taking the toll. It's a whole kinetic chain of movement, right? So one thing kind of leads to another. So yes, it's very important to get it addressed right away, seek a professional, get some imaging, and then after that, possibly see a physical therapist or a movement specialist to try to see what we can work on.
Yeah, because it's sort of your body, if you try to overcompensate by, let's say you do have that knee pain, and then you're like, why does my hip hurt? I've heard that excuse where it's because you're as you mentioned, you're overcompensating. Your body's, you're trying to do something, and therefore it's sort of out of whack. And I assume that then you have to go and retrain them and work them all through again, so that you're avoiding that issue.
Yeah, definitely. I mean, we see it more, well, we see it pretty much with everyone, but I would say we probably see it more with like post-surgical patients. For example, total knee replacement, right? They get a knee replacement, or they get an ACL surgery. They're, for the most part, sometimes instructed to not bear weight on it. So then they're using an assisted device like crutches or a walker, and then they kind of start getting away from the normal mechanics of walking, and then it starts causing hip pain, it starts causing low back pain. And once they go through the recovery process and they get cleared by the doctor, it's our job to kind of retrain those movement patterns, because it's crazy how fast they lose how it should feel to walk, right? So it's pretty amazing what the body's way of compensating for certain things. The
next one that we touched on a little bit is osteoarthritis, and obviously that's sort of degenerative joint disease. It's kind of like the wear and tear, and it causes pain, stiffness, and reduced mobility. Do you see a lot of osteoarthritis in the center?
Yes, hip, knee, shoulder. I see it a lot, and what I will say about that is a lot of patients, sometimes when they get that diagnosis, osteoarthritis, they think it's a disease. They think it's the end, right? But it's basically that. It's just a medical term for wear and tear. And if, for the most part, if we get the body moving or the joint moving how it should be, it kind of clears up some symptoms of what they're feeling. And sometimes even we're even able to kind of reverse the effects.
And then rheumatoid arthritis obviously is an autoimmune disease where the body's immune system attacks its own joints. It causes inflammation, pain, and potential joint damage. So that is also an issue that we should really be paying attention to when it comes to arthritis, rheumatoid arthritis.
Yeah, so that's a little bit different. That's an autoimmune disorder, and that does require doctor's medication, and we do have a different protocol for that. So it's two different things.
Yeah,
but it's
people may hear arthritis and think osteo or just rheumatoid.
Yeah, and there's even like juvenile arthritis. I mean, there's a lot of when the word arthritis is thrown around, there's different meanings that can be derived from that, right? So that's part of when we see a patient is the education part, right? Is it osteoarthritis or is it rheumatoid arthritis? Because it's going to be two very different protocols and methods of treating each.
Now you also get other inflammatory conditions like gout, lupus, and other conditions that also can affect the joint. So I hear a lot about gout, and I know that when there is a gout flare-up, the difficulty in walking, it's almost brutal to walk. So how do you deal with gout when it comes to physical therapy?
Yeah, so that's another process that we treat very differently. It's basically the accumulation of uric acid within the joint, which causes it to swell up. For those, it's a little bit different, right? We want to address the signs and symptoms first. So if they're having a lot of pain and inflammation, we need to address that before we even go into the stretching and like the walking and the squatting and so it's a very different approach. But we do have ways to treat it, right? Like massage, electrical stimulation, heating pads or cold packs, depending on what type of injury or disease process they have.
Now, one that I think you probably see a lot of is overuse or repetitive motion injuries. So I know that when you're talking about like a tennis player and a serve, that repetitive motion can cause a shoulder injury and issues with that joint. I know that my dad, when I had a sheet metal shop, and he had this one machine, and he had one guy who would just do this all day, a lever that would just cut a hole into a piece of sheet metal. That kind of motion, you have to be really careful with those, right?
Well, repetitive motions are always going to put a lot of strain in the joints, but also in the tendons, in the tissues, right? You mentioned tennis, right? We get a lot of tennis elbow, but that's more of a tendinous issue, right? But then it can lead into those joint related issues, right? So that they're not serving well, and then it starts kind of trickling into the shoulder type of stuff. So it changes the way the joint is moving, right? But like I mentioned earlier, a muscle or movement issue can lead into the joint issue, and then it's kind of like a cycle. So our job where we come in is just trying to get that patient out of that cycle, trying to figure out what's the irritating factor, and then addressing that.
The next one is obesity. So excess weight puts added stress on weight-bearing joints, accelerating cartilage damage and increasing pain. So carrying extra weight is really bad for our bodies.
Yes, I know it's sometimes it can be a little a topic there that might be a little sensitive, right? But I think it's a very important topic to talk about because, yes, like you mentioned, if we're carrying more weight in our body, we're putting more strain on our joints, right? We're loading the joints a little bit more. It's also harder for us to want to move, right? So a patient that's carrying a little bit more pounds on them, they're going to be very unmotivated to move, and it's also kind of they go into that cycle to not moving so much, and then like I mentioned in the presentation, the not moving kind of wears down the joint, and then because of that they get pain, and then because of that they want to move less, and it's just a cycle. So for those types of patients, I'd probably recommend just starting with like a low impact aerobic activity like swimming, cycling, something that doesn't require for too much loading of the joints. But it's very essential for joint health, but also maintaining a healthy weight, right?
And I've seen it on social media now that they have chair exercising that you can do. It's like calisthenics in your chair. So you can do all these motions and without really having to put a lot of pressure on the joints. So look out for any of those sources that you can use to help you with the battle of the bulge, so to speak.
Yeah, I mean, if anything, right? Like just trying to find anything to get the body to move how it's intended to, because we were designed to move, right? We were not designed to be in an office all day, right? Even though we are. But trying to move, like I like to tell patients that sit in a desk for most of the day, set up a timer on your watch. Most people have smart watches now. Set up a timer every hour, get up, walk around a little bit, and then get to work again, or 2 hours or whatever. It's better than not moving and just being sitting all day, which can cause issues in the hip, issues in the lower back. I mean, I see it every day. So any movement, I would say, is better than no movement.
And the last common cause of poor joint health is age. So unfortunately, as we get older, you mentioned it, you start hearing all the sounds that you didn't normally. I hear cracking toes and knees, and so you're going to hear that more often. But despite the age, you should still be working out, right? Yeah,
so I know it seems kind of counterintuitive, because the older we get, the more the tissues, the collagen, we kind of just lose the collagen within our joints and the elasticity in certain structures. So, but with that being said, the older we get, the more we need to do to kind of take care of ourselves. Like, I think it's after the age of 30 or 40, I read an article out there that you kind of lose 3% of your muscle mass, right? If you don't work out, right? So trying to combat those statistics and trying to go against the research and trying to tell yourself, like, hey, even though the research says this, I'm going to try to prolong my joint health, right? Prolong my strength. I'm going to go out there and put in some work, supplement, recover. There's a lot of new stuff going out there as far as like recovery with like red light, the benefits of sauna, the benefits of cold immersion. So there's a lot of stuff going out there, but I always say just keep it simple. If going out for a walk is the only thing the only time you have to do that, then go for a walk. If you have a little bit more time, do some strength training. Like I mentioned earlier, some movement is better than no movement.
And the physical activity guidelines provided by the U.S. Department of Health and basically says that we should be getting 150 minutes of moderate intensity aerobic exercise a week. So that's about 30 minutes a day. So even if we are experiencing joint pain, we still need to try to find those opportunities to move our bodies.
Yeah, and I mean, like I mentioned as well, there's options, right? So if we're having issues with the knee, then let's just do upper body. All right, or if we're having issues with our shoulders, then let's get on a bike, right? So we're kind of stimulating indirectly those stimulation from our brain to lubricate those certain joints by working indirectly on other more proximal or distal joints, right? So just kind of trying to be positive as far as that, trying to get any type of movement out there. If we have an ankle injury, then work the other leg, right? So yeah.
And find a swimming pool, because I know a couple of summers ago, my brother had a pool at his house that I was always in. I would put weights on my feet, and I would just do kicks, and I would swim, and just trying to do exercise. And a pool is a great way to just kind of not worry about the load on your muscles and just really doing the movements that you need to do.
Yeah, and I'm glad you mentioned that, because we were talking about elderly right now.
Are you calling me elderly? Is
no,
what you're gonna say?
No. But we were talking about like geriatric older patients, and sometimes when they do have those issues, right, the moderate to severe arthritis in their knees and their hips, I've been noticing more of a trend with like water aerobics. I know McAllen, I think, has a program. I'm not sure if other surrounding cities have that, but I know the McAllen City Pool does have aerobic water aerobic for geriatric population. So that's awesome. You're offloading the joint, but you're still kind of getting that exercise in.
And it should be fairly cost effective to go to the Parks and Rec. It shouldn't be as expensive as going to a private pool somewhere, so to speak.
Yeah.
Now let's talk about the common early signs of joint issues. So obviously, what should we be looking out for? So persistent joint pain. So that's something that we should be looking out for, right?
Yeah. So for osteoarthritis, I think the initial onset is like stiffness in early morning, pain early morning, which gets better with movement once you warm up the joints. That's typically how it starts, and then once it progresses, like the wear and tear progresses, the pain and the stiffness tend to last a little bit longer, and sometimes it's, even if you warm up, you're still experiencing. But the early onset is typically that morning stiffness with pain in the morning that gets better with movement.
And then swelling or stiffness, which you talked a little bit about that stiffness. So ongoing joint swelling and stiffness, especially in the morning or after sitting, could signal joint inflammation. So the joint may appear puffy, feel warm, or become difficult to bend or fully straighten.
Yeah.
So paying attention to the swelling and stiffness. Next one is one that I hear a lot, unfortunately, is clicking, popping, or grinding. So if you're hearing any of those kind of sounds, you really need to be paying attention.
Yeah, and the biggest thing is try not to self-diagnose yourself. Seek a medical professional, whether it's your primary care doctor or getting imaging or seeking out a physical therapist. Because sometimes people try to self-diagnose themselves, and they go down a rabbit hole.
WebMD is not your friend when you're trying to think like, okay, I'm hearing clicking, and then all of a sudden, it's the rarest disease you've ever heard of.
Yes. So, I mean, that can be a cause for alarm, but I always say, like, if you feel like something's wrong, something's off with your body, the best thing to do is just seek medical attention.
Next one is limited range of motion. So if your joint feels stuck or you're avoiding movements due to pain or discomfort, you could be experiencing early signs of arthritis. Tasks like squatting, turning your head, or carrying groceries may become harder, right? So that limited range of motion. And I know for some of us as we get older that we do sort of see that range of motion become a little bit more limited. But so how can we differentiate when it's just growing older or when it's a serious issue?
I mean, like I mentioned, it's good to try to seek professional opinion, right, from a doctor. But typically, when it starts being serious, is when it's associated with you're not just noticing joint mobility restrictions, but you're also getting pain. Sometimes if it's like in the spine, you might notice some numbness, tingling in the hands, or if we're talking about issues in the lower back, you might start feeling some radicular pain into the leg. Those are all things where, okay, you know what, it's time to go get checked and see what's going on.
Another of those common signs is weakness or instability. So I know that instability, especially like after my ankle injury, like I always felt a little wary about walking on it in any specific way or turning or twisting in any way, especially playing tennis. You know, like I worry about that. So that instability could be something that you want to make sure you talk to a doctor about.
Yeah, that's something that you can potentially bring up. I always like to say, like, instability and weakness kind of go hand in hand together, right? So if there is an issue of weakness, whether we're talking about the knee or the hip or the ankle, there's probably going to be some type of instability, right? So we kind of have to work hand in hand with both to make sure that the patient ends up being confident, right? Like you said, so confidence to taking a step, being in a single limb stance. So those two things are very important.
And obviously joint health is a lifelong process. It's not something that you do when you're a kid and you never work on it again. But let's talk about childhood and joint health, because there are parents who watch who may want to think, I'm putting my child in sports, things like that. So what can we be doing as what can parents do for their kids to make sure that they, you know, are protecting their joints at a young age?
So getting seen, right? A lot of these athletes now, they have trainers within their school district, and it's important for them to be getting treatment, whether it's during season and off season, or prior to a game or after a game, getting treated, whether it's by doing modalities or stretching. But one of the things that I see a lot too is, like, some of these athletes are playing year round, and they don't get that off season to work on the strength deficits or muscular imbalance, joint mobility restrictions. So they kind of play throughout the whole year season in the school, and then summer league, and then like travel team. And it's like they're playing year round, and then by the time they're in high school or playing college or whatever the case may be, they're suffering from all these aches and pains because they're not allowed to take the time to recover and work on these muscle imbalances that are developed for whatever reason. So that's, I guess those are my 2 cents as far as that, trying to make sure that we are taking an off season, letting the body recover, working on those muscle imbalances. I do treat some athletes currently that I have seen in the off season, and we assess them and we're like, hey, we notice a restriction over here, or hey, there's a little imbalance over here. Let's work on that. So once the season starts, you're not just good, you're like great. You know what I mean? And you're feeling good, because if you're feeling good, you're going to be playing good. So that's something that I like to educate parents on, because sometimes they think like more is better. So then they're playing in all these leagues and they don't get the chance to kind of let their body recover, which is important.
And working on technique and making sure that you have all of those techniques in place, that you're doing them correctly, those movements correctly, right?
Yeah, especially certain things like, I mean, golf, it's a very technical sport, right? You have to have a lot of range of motion throughout your thoracic spine, shoulder, hip. If not, it's going to affect your swing. Likewise with baseball, pitchers, right? If they're lacking some mobility at their elbow, then they're going to start having shoulder issues probably. So it's important to look at all these things, and like I said, it's multifactorial. So we got to look at a bunch of stuff and see what they're doing off the field, what they're doing at school, and sometimes just communicating, like having that communication with the parent, but also having the communication with the coaches and the athletic trainers. I feel like that's been the awesome equation to deliver great results as far as what I'm seeing with our high school athletes currently.
Now, when we get into young adult stage, we're now going into the workforce, which means we're starting to be at our desks more and moving less. So as you mentioned, putting a timer on, making sure that you're taking breaks away from the desk, getting some walking, moving, going up and down stairs, whatever you might be, but not just sitting still for long periods of time. Yeah,
and I mean, there's ergonomic changes that you can do. Your desk, make it a little higher so you're not stooped forward. Maybe get a better chair with some back support. Little things like that you can improve your posture. But yeah, getting out of your chair, walking around, doing some dynamic stretching, because we were designed to move, right? We're creatures of movement. So anytime we don't move, we start feeling, for the most part, all stiff and not like ourselves, right? And then obviously for seniors, when we get into our golden years, we really need to make sure that we're moving. And I've noticed this with my mother. She's in her 70s and she sits and watches TV. She's on her iPad. She's probably judging me right now for talking about it, but she's playing solitaire while watching the Astros play and having a conversation or whatever. But she doesn't really move from the sofa much. And I tell her, you need to get moving. And she started rehab today, so I'm hoping that's going to help her. Yes, so I'm hoping. I'm hoping that she's going to be able to do that, because she talks about how she can't move much and things like that. So that is where those issues will come up, the back pain, those issues if you're not moving. So as seniors, get moving. Yeah, and there's a lot of new programs out there. Like I know some gyms have the Silver Sneakers program, where their health insurance pays for a gym membership and pays for a trainer, and they can use those services to be able to move and get out of the chair, right? Get out of just watching TV and be healthy. And even if you don't have the Silver Sneakers or whatever the organization is, even if you don't have that or can't get to the gym, just a simple walk around the block for 15, 20 minutes around the block. Start slowly. Get moving, and hopefully you'll kind of get the rhythm going. You get your juices flowing, and you'll be able to really move better. Yeah. Now let's talk a little bit about the importance of some tips. So we can talk about some fun tips. So the first one, which we've talked about and we just finished talking about, is stay in motion. The golden rule of joint health is stay in motion. The more you move, the less stiffness you'll have. Right? Yeah. So just move. Motion to lotion. Yes. Whether it's just throwing your hands out in the air, kind of opening up your chest, anything really to to get the body moving.
And even if you're reading, if you're working, or you're watching TV, you can always work on changing positions, doing different things, so that way you're just not staying stagnant in one spot for too long.
Yeah. So yeah, like I mentioned right now, ergonomics, right? So if you're reading, or now we have the issue with the text neck that they call, right? With all this just leaning forward, and they start getting a lot of neck pain. So just kind of working on the ergonomics. I'm not saying don't use your phone, but maybe instead of being down here, you can be up here, or like recline on something, right? Just being aware of those postures, and I mean, you can use this timer method with that too, right? You have to work on something, you're on your phone. Hey, put a timer every 20 minutes. I'm going to stand up. I'm going to stretch. I'm going to move around. So all those are good things that we can kind of do or incorporate to keep our joints moving.
And if you are sitting for prolonged periods of time, take breaks and get active. So just make sure that you take that break. And I know that we have South Texas Healthy Living is our program that we have that runs on Sunday mornings at 9 a.m. on NBC 23. And Jerry's actually done some exercises. And we've done the exercises where you can be doing them during a commercial break.
Them.
I know, right? But you can be doing them during a commercial break. You get up and do a few little exercises.
Simple stuff that I know I've kind of shown variations of it that don't require any equipment. So you don't need a band, you don't need any equipment. You can just kind of do them using your body.
Next tip, safety first. So padding is your pal. So if you're going to be doing any kind of athletic exercise, making sure you're wearing, like if you're playing football, making sure you have the pads, the helmets, all of those things to protect the joints and the body itself, right?
Yeah. So I mean, the padding, right, protecting the joints. You see it in mostly every sport, right? You have different parts of the uniform that protect. Like volleyball, you got the knee pads because of all the diving. So little things like that go a long way.
Yeah, so just making sure, even if you're having a fun game of volleyball in your backyard, making sure that you're wearing some pads to protect yourself just in case. Shed some pounds. So every pound you lose takes 4 pounds of pressure off the knees, according to research. So just making sure that you're maintaining a healthy weight, trying to just lose a little bit of weight can go a long way. Yeah,
so shedding the weight is definitely going to help those weight-bearing joints, like the knees, for example. It's just going to be better, not just for that, but for your overall health. Yeah.
Stay hydrated. So water, it's important to drink plenty of water. We talk about it for our general health, but also for our joint health as well. Hydration. And then avoid excessive alcohol and smoking. Those lead to inflammation and other issues. So just trying to avoid anything like that, especially if you're dealing with joint pain.
Yeah. No, and it's amazing what that does to our body just in general, like how it actually causes inflammation to the body. So some patients that might have like gout, it can flare it up, right? So just being aware of those things and go a long way.
All right. Stretch daily or at least 3 times a week. Stretching is your friend, right? You gotta make sure that you're stretching.
Yeah, stretching. Research says dynamic stretching is probably the better way. But like I mentioned, it's multifactorial, so you got to get your resistance training in there as well, balance training, and kind of use all those 3 as in a group, right? And that's going to deliver the best results.
Now, is it true that you shouldn't just start stretching right away, that you should like warm up a little bit, a very light warm up, like a walk or something, just to kind of loosen up a little bit before you start doing the stretching?
Yeah, so getting the blood going, right? So if you don't really stretch and then you go into like a static stretch and you kind of push too hard, that can sometimes even lead to an injury. I've seen it happen in a couple of patients I've treated. They want to start their wellness journey, and then they don't have any guidance, so they kind of go too hard too quick, and that can cause issues, right? So just gentle stretching, like you mentioned, just warming up, sometimes just warming the body, because we want to warm up the muscles, going to warm up the tendon, and then those stretches might feel more comfortable. So little tip there.
Now, work on your range of motion. What can we do if we want to be working on that range of motion? Are there any exercises or any tips that you have for just kind of making sure that we're working on that?
Yeah, so the joint mobility is very important, right? Because we got to get those gliding surfaces in the joint. Sometimes it's difficult to get into the joint mobility part because the muscles are so tight. So in those cases, we want to stretch out the muscles first, and then do some self-mobilizations, like laying on a foam roller and then just kind of leaning into it. If that's too unbearable, you can put it across your chair and you can just kind of lean. And that's more like to mobilize the thoracic spine or lumbar spine. There's a lot of different variations that you could do, but those are some examples that you can incorporate.
Now, power up your core. We always talk about the core being so important. It helps with balance. It helps just basically keep us moving. It's really important to build up our core. Right? We don't have to have a six-pack, but we just have to have a strong core, right?
Yeah, core is very important. I mean, we see it in gymnasts. The reason why gymnasts can move the way they do is because their core, their midline is so strong. But it also translates to balance. So we see it a lot in the elderly population. Their core is very weak, and that's the middle part of their body, right? That's where their fulcrum is. So if that's thrown off, everything else is going to be thrown off as far as their balance. That's when we start leading to like fall risk. So yeah, it's very important.
Know your limits. And I know we tend to push ourselves really hard. There are people who maybe not have gone to the gym for a while. Okay, they're going to go hard, and then they wake up really sore the next day. So what are your tips to making sure that we're easing into exercise and doing what we need to do to still stay safe while trying to get better?
Yeah, so listen to your body. I mean, it's kind of hard sometimes because sometimes we want to base ourselves based on what we could do 10 years ago. And sometimes that's not very realistic because a lot of things have changed, right? So kind of just listening to the body. If we're going into a static stretch or dynamic stretch and we're like, oh man, that kind of feels like a little funky, maybe taking it easy and not forcing it through the full range. So that's kind of like something we want to keep in mind because going too hard too quick in itself can lead to some injuries.
Now, tell us about the importance of hot and cold therapy. We see icy hot on the shelves. We see, why is it so important to like chill the pain and to use the heat to sort of, relax the muscle?
Well, typically we like to use cold therapy more so in the acute stage of healing. So when there's bruising, when there's inflammation, to try to tone that down, right? Once you're in the more like chronic stage, they're past the inflammation stage, we want to use heat to warm up the muscles and get everything moving, right? Why? Because heat tends to be a vasodilator, so it kind of increases blood flow to the area. But if there's a lot of inflammation in that area, we want to constrict those blood vessels to kind of get rid of that swelling first, right? So in the early stages, I think cold would probably be the way to go, and then in the later stages, we want to do more of the heat. But sometimes they go hand in hand. Sometimes we'll even do contrast.
Okay. Now let's say I am feeling that I have some joint issues. I can go to SDHS McAllen, your outpatient rehabilitation center, and get an assessment. Is that right?
Yes and no. So we because we're part of the hospital, we follow hospital policy. So we don't have direct access yet, meaning that you can't just go and see a physical therapy. But we do have a method which we do screeners. So
a screener.
So we do like an informal evaluation, and then we're like, hey, you might benefit from physical therapy, and then we handle all that process. Whether they have a PCP, we give them a script, they take it to their doctor, and then when they come back, and then we start the whole process. There might be sometimes where we do the screener and we're like, hey, this is kind of a little more tricky, right? You might want to get some imaging, or I think there might be something else going on, and then we kind of send them to wherever they need to go as far as that, whether it's the emergency room or back or to their PCP to get seen for or assessed for what we think is going on. But we do the screeners, right? So that's kind of a way to kind of get them in, and all they have to do for the most part is just call our office at 956-971-5640. Let them know that they want to get screened for whatever the case may be, and then we get them set up.
But it's a screener, so just making sure you remember that keyword.
Yes.
Is a screener. But that's your way to at least take a quick look
sit
at
down,
them,
talk,
and figure out, and then you can recommend they go see a specialist, a doctor, their PCP, they get MRI or whatever that you think may need if you're able to see.
Yes, but ultimately we would need the referral to
begin actual physical therapy and rehab. You're gonna need to have that doctor's order.
Yes.
Yeah. And then once you set them up with rehab, so you do have that doctor's order, I understand that you create basically an individualized plan for each patient, right?
Yeah, so everything is, the great thing about our STHS outpatient rehab is that we're a one-on-one rehab facility, right? So every patient that comes in, they're designated with their physical therapist or their physical therapist assistant, and every patient we see has their own specific treatment plan, right? And it might differ from somebody else's treatment plan. So for example, there can be 2 patients that are seen for low back pain, but it's a totally different approach, right? Depending on what we see, if it's a disc herniation or more like sciatic type of pain, radiculopathy. And with the assessment, we formulate a plan and we give them specific exercises, specific manual techniques, and then they have their own plan. And I feel like that's what has given us the best results. And I think that's why we've grown so fast too, because people talk, right? So I see a patient and then 3 months later I see the patient's brother, or it's like, hey, they told me about this place, and it's just grown so much. But I think that's the key that makes us so successful, that we have that one-on-one care, and we're actually sitting down, having that open communication, and have that whole hour to really assess and fine-tune those little details.
So last question, when should we go and see a doctor if we are experiencing any type of joint pain? What are the telltale signs that you really need to see someone right away?
Yeah, so obviously pain is a big one, right? When we start feeling pain that wasn't there before, severe joint mobility restrictions that are causing you to change the way that you do things, whether it's at work or at home. All the little things are like a red flag, like a check engine light, right? You need to go get checked, because sometimes it could go away by itself, but then other times it can turn into a bigger thing, right? So catching it early on is like the most important thing. And to me, that's kind of like the red flag, right? Hey, there's pain. There wasn't pain yesterday, and this pain is affecting my joint mobility. Now I can't cook. Now I can't go to work. Now I'm having to take time off from this and this. So those are all things that are not normal. Definitely need to get checked out before it turns into something more severe, right?
So the check engine light, not just on your car, but your body's check engine light, pay attention to it.
Yeah,
Don't ignore it. On the car, we might ignore it, but not for your body, right?
I don't know why I always go to a car analogy. I just feel like people understand it really well. But yeah, those are the telltale signs, like, hey, you need to get checked out.
Alrighty, well, thank you so much, Jerry. We appreciate your time.
Yeah, appreciate you having me.
All right, and that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, September 16th from 5:30 to 6:30 p.m. when we will discuss sepsis. Like and follow the South Texas Health System Facebook page for more details on our future Let's Talk webinars. And if you'd like to see our previous seminars, all you have to do is visit STHSLetsTalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.